Welcome to this educational video on oral submucous fibrosis, or OSMF. This debilitating condition primarily affects the oral cavity, leading to significant difficulty in opening the mouth and impacting overall quality of life. We'll explore the causes, symptoms, diagnosis, and management of this complex disease. The primary culprit behind OSMF is the habitual chewing of areca nut, often found in pan, gutka, and other chewing tobacco products. Areca nut contains alkaloids that stimulate collagen production and cross-linking in the oral tissues. While areca nut is the major cause, other contributing factors include genetic predisposition, nutritional deficiencies, particularly iron and vitamins B and C, and in some regions, chili consumption has been implicated. OSMF's pathophysiology is complex and involves several key changes in the oral mucosa. The areca nut alkaloids, primarily arecaline, stimulate fibroblasts, the cells responsible for collagen production. This leads to an overproduction of collagen, which is then abnormally cross-linked, resulting in rigid and inelastic tissue. There is also an increase in mast cell activity, leading to the release of inflammatory mediators. This chronic inflammation causes epithelial atrophy, decreased vascularity, and ultimately, fibrosis or scarring in the submucosal tissues. In advanced stages, even the muscles of mastication can become involved. OSMF is predominantly seen in South and Southeast Asia, particularly in India, where the habit of chewing areca nut is widespread. Migration patterns have also led to cases being reported in other parts of the world, including the United Kingdom, Canada, and the United States, primarily among individuals of South Asian descent. Prevalence rates vary significantly depending on the region and the extent of areca nut chewing habits. The early signs of OSMF are often subtle and may include a burning sensation in the mouth, especially when consuming spicy foods. As the disease progresses, individuals may experience difficulty in opening their mouth, a condition known as trismus. Other symptoms include a stiff tongue, blanching or paleness of the oral mucosa, ulcers or blisters in the mouth, and difficulty in swallowing. The texture of the oral mucosa changes, becoming leathery and less flexible. Speech can also be affected. Diagnosing OSF typically involves a thorough clinical examination by a dentist or oral surgeon. This includes assessing the patient's history, especially their chewing habits, and examining the oral mucosa for characteristic signs like blanching, fibrosis, and restricted mouth opening. A biopsy, where a small tissue sample is taken and examined under a microscope, is often performed to confirm the diagnosis and rule out other conditions. Imaging techniques like MRI may be used in advanced cases to assess the extent of the disease and involvement of deeper tissues. OSMF can be classified based on the severity of symptoms and the extent of fibrosis. One common classification system divides the disease into stages based on the degree of mouth opening and the presence of palpable fibrous bands in the oral mucosa. These stages can range from very mild, with minimal symptoms, to severe, with significantly restricted mouth opening and extensive fibrosis. Currently, there is no cure for OSMF, but treatment focuses on managing the symptoms and preventing further progression of the disease. This typically involves lifestyle modifications, such as complete cessation of areca nut chewing. Medical management may include corticosteroids to reduce inflammation, antioxidants like lycopene and vitamin E to combat oxidative stress, and iron supplements to address nutritional deficiencies. Surgical intervention, such as excision of fibrous bands or tissue grafting, may be necessary in severe cases to improve mouth opening. Physiotherapy, including mouth opening exercises, is crucial to maintain flexibility and prevent further stiffness. The most effective way to prevent OSMF is to avoid the consumption of areca nut in any form. Public health campaigns aimed at educating individuals about the dangers of chewing areca nut and promoting healthy lifestyles are essential. Early detection through regular oral examinations is also important, as early intervention can help slow the progression of the disease. The prognosis for OSMF varies depending on the stage of the disease at the time of diagnosis and the individual's adherence to treatment and lifestyle modifications. While treatment can help manage symptoms and improve mouth opening, the fibrosis is often irreversible. Importantly, OSMF is considered a potentially malignant disorder, meaning it carries an increased risk of developing oral cancer. Regular monitoring and follow-up are therefore essential. Recent research is exploring novel therapies, including gene therapy and stem cell-based approaches, to potentially reverse the fibrosis and regenerate damaged oral tissues, offering hope for future treatments.